Hello guys, Dr. Aguilar one more time here with you. And this time we're going to talk about IBS. That's Irritable Bowel Syndrome. Quite common problem, and it actually affects a lot of the population in the United States and actually the world. Symptoms are usually like bloating, gas production, feeling like when they're eating, they're getting full right away. They get discomfort in the abdomen pretty much everywhere, up and down. They have problems going to the restroom, for example. The bowel movements either are sporadic or they have diarrhea. And sometimes it comes along with nausea, heartburn, and other symptoms. In general, this big word, irritable bowel syndrome, applies to all of these conditions that can give you these symptoms. But basically what's happening is that your gut is not happy. Your gut is not healthy. Your gut has inflammation all over the place. Now there are other conditions that can mimic IBS, like Crohn's disease, ulcerative colitis, and other diseases. But for the most part, what needs to be done is a general evaluation of what can be triggering or causing the problem and the symptoms. Now, we know that there can be a bacterial overgrowth, there can be fungal overgrowth, but most of the times this irritable bowel syndrome is caused by inflammation to your gut in the way of toxins, bad food, too much sugar, too much dairy products can be the case. Only about 30% of the population, maybe, we're not sure about the number, are gluten sensitive. Therefore, not everybody with IBS is gluten sensitive. Nonetheless, taking away gluten from the diet is an important first step to find out who you are and if you are sensitive or not. In functional clinics, I believe that's the perfect place to treat this kind of condition. You can be tested for micro and macronutrients deficiency. You can be tested for allergies to specific kind of foods. You can even be tested genetically to see if you have a predisposition to be affected by this condition. And if you've ever been told to have colitis, that's one of the multiple possible causes of IBS. And colitis is very common. So my recommendation is this: if you have one or multiple of those symptoms that I mentioned before, if you've been told to have IBS, if you've been told to have a condition by the name of leaky gut syndrome, which is extremely real and common and comes along with the same symptoms, then you ought to be seen in a functional clinic, whichever way you want to go. We at TIMC, that's Texas Integrative Medicine and Cardiology, are experts on the topic. We would like to help you and start a pathway for a new healthy gut. Diseases or health start in the gut. Take care of your gut. Until next time, have a wonderful day.